Hello, this is Dr. Rittinger from OVP Health. I'm the Director of Hospital Medicine, and today we're going to talk about patient satisfaction and our Knock, Sit, Ask initiative. So why so much focus on patient satisfaction and experience? Let's look a little at the history. Well, many of us remember the time that patient satisfaction was never really discussed. It wasn't until 2002 that CMS and AHRQ worked together to research and develop what is now known as the Hospital Consumer Assessment of Healthcare Providers and Systems, or for short, commonly referred to as HCAHPS survey. The HCAHPS system was subsequently implemented in 2006, and score reports were first publicly available in early 2008. We often refer to these as Press Ganey scores. Press Ganey is just one of the approved vendors that can administer these surveys on behalf of CMS. In 2016, the HCAHPS survey became 25% of a hospital score under what's referred to as the value-based purchasing program. In short, the hospital could be penalized upwards of 2% across the board for substandard scores. In addition to financial ramifications, there's growing evidence that the patient experience directly impacts clinical outcomes as those patients transition into the outpatient setting. The patient experience relies just as much upon the quality of the interaction as it does the quality of the care. I really want to emphasize this point, quality of the interaction. That is the goal of what this initiative is focusing on, improving the quality of the interaction during our patient's visit. We often hear the words patient satisfaction and patient experience used interchangeably, and in fact, they are quite different. Patient experience is measuring whether something that should happen in the healthcare setting, for example, clear communication, actually happened. On the other hand, patient satisfaction is whether a patient's expectations were met during their visit. We could conceivably have two patients receive the exact same care, have the exact same outcome, but can give two different satisfaction surveys solely because they had different expectations. So how do we impact that? First is recognizing those differences exist among our patients. Next is taking the initiative to ask patients about their expectations. For instance, if a patient expects to receive a particular treatment during their stay, say an antibiotic, and we don't provide that because it isn't indicated, the patient is likely to leave unsatisfied. If we are able to understand that expectation and then clearly communicate why an antibiotic isn't appropriate in this setting, we increase the chances that that patient leaves with a more positive perception of care. So now let's move on and talk about the survey components. The HCAHPS survey consists of 27 questions across 8 domains. While we can have an impact on multiple of these questions, our focus today will be on the doctor's communication domain. There are 3 questions within this domain. During this hospital stay, how often did the doctors treat you with courtesy and respect? During the hospital stay, how often did the doctors listen carefully to you? During the hospital stay, how often did the doctors explain things in a way you could understand? As you'll note, the capitalized areas are very key. Courtesy and respect, listen carefully, and explain things. The Knock, Sit, Ask initiative is an incredibly simple concept that will support improvement in all of these areas. So this concept seems simple enough, right? Knock. However, I would challenge you to think of it this way. This is the patient's first impression of you. When you walk in that room, that establishes the groundwork and the foundation for the patient experience. A knock is an indisputable sign of courtesy and respect. This is a simple concept we teach our children before entering a room, and we should expect the same from ourselves. Knock and ask permission to enter. Miss Smith, I'm Dr. Rittinger. Is it okay if I come in? If the patient is in the emergency room and behind the curtain, you can still accomplish the same concept by announcing yourself and asking before entering. Obviously, in the case of a demented and unconscious or ventilated patient, this won't be applicable. However, there could be family at the bedside, and they may in turn be the ones filling out the survey. Next, introduce yourself to the patient first, then any visitors that may be present. Again, keeping in mind that this is the first impression. Finally, another excellent way to show respect to the patient is when visitors are present, ask the patient if it's okay to proceed with questions. Miss Smith, is it okay with you if I ask you some questions now, or would you like to have your visitor step out? Oftentimes, the visitors that are not close family will gladly excuse themselves. On the other hand, imagine a patient's perception if you come rolling in the room unannounced, looking at your phone or talking to a nurse about a patient that you just saw. Miss Johnson, oh, sorry, Miss Smith, right. What's bothering you today? While this seems simple, this is an area of focus that we can make a significant impact on the patient experience. This also lays that foundation for future interactions. So let's move on now to sit. Another simple concept, right? Concept we've been taught early in our training, sit down and talk to the patient. Sitting during this time gives the impression to the patient that you're not in a hurry. You're interested in what they have to say. First, find a place where you can sit and have clear eye contact with the patient. In some circumstances, this may not be possible, and standing at the patient's bedside may be required. Next, try to ask open-ended questions to allow the patient to tell their story. Find opportunities to repeat important points back to them, affirming to them that you understand their complaints and are listening. Empathize with the patient. Miss Smith, I'm sorry you're having this trouble. I can imagine you must be scared. Another opportunity to show respect, ask permission to examine the patient. Miss Smith, well, let's see if we can figure out why you're having all this pain. Is it okay if I take a look and listen? After you complete your exam, return to your interview location, seat or bedside, and summarize your findings. Utilize teachback. For those not familiar, this is the concept of having the patient repeat back to you anything you intended to explain about their treatment or care. Miss Smith, just so I can make sure we're on the same page, can you tell me why we need to get this CT scan? Or, Miss Smith, I want to make sure I explain things clearly. Can you tell me why we're going to have your husband admitted to the hospital? Again, this isn't a difficult process, but for many of us, this will be a change in how we do things. Finally, let's go to the last concept, ask. Our final concept, and again, not that difficult, is ask. Very important. This should not be done as you're slowly moving to the door or in the doorway ready to leave. This should occur prior to getting up from your seat or leaving your interview location at the bedside. Make sure to ask these questions in some form. Miss Smith, do you have any additional questions or concerns before I go? Is there anyone you'd like us to get in touch with or update on your condition? Finally, ask if there's anything else that they need or that you can help with. This may be as simple as a blanket or a glass of water. Remember, this is also an opportunity to identify and address any false expectations. Under-promise and over-deliver. Don't tell the patient you'll be back in 5 minutes if you aren't sure that's going to happen. Instead, stop in and see a patient when they get back from their test and say, your results aren't back yet, but just wanted to check in and see how you're doing. This will go a long way. Finally, thank the patient for giving you the opportunity to take care of them. Well, Miss Smith, we've talked with Dr. Rittinger and he's going to be taking care of you upstairs. Let me know if you need anything, and we really appreciate you trusting us with your care. In summary, let's remember the earlier statement we made. The patient experience relies just as much upon the quality of the interaction as it does the quality of care. Remember, the patient experience measures how often something happened that was supposed to happen, where the patient satisfaction measures meeting expectations. We have to be sure to identify and resolve false expectations. Using the tools we've talked about, knock, sit, and ask, we can improve the patient's experience through courtesy and respect, listening carefully, and ensuring they understand our plan. Thanks for your time and your attention. Feel free to reach out anytime with any questions or if you have any challenges or suggestions you want to discuss.